Dr. Kaustubh Basuthakur, consultant physiatrist, Rehabilitation Clinic, Kolkata. His topic on role of magnesium in rehabilitation.
Thank you, respected chairpersons. Wishing a very good day to all the delegates. My topic is role of magnesium in rehabilitation. So overview, it is found to be the fourth most common mineral in the human body after sodium, potassium and calcium. It is also the second most common intracellular cation after potassium. We can see that the maximum is present in the bone around 53% and lowest in the serum, which is 1%. Along with this, muscle contains 27% and soft tissues also. Normal serum value is around 75 to 95, but anything below 85 is considered to be deficient. So I'll be mainly focusing on the functions, the mechanism of action and how it helps us in the rehabilitation rehabilitation. So in the muscle function, we know that magnesium acts as a physiological calcium antagonist. It prevents the influx of calcium into the myocyte in the troponin as well as the voltage gated calcium channels, and ultimately prevents prolonged calcium binding, prolonged depolarization. Along with that, it also activates the sarcoplasmic reticulum calcium ATPase pump, which allows for the clearance of the calcium from the cytosol, and it is taken up into the sarcoplasmic reticulum. It also supports the magnesium ATP formation, which is required for the relaxation of the muscle in between the contraction. So how it helps us? It can help us in reducing muscle spasm, hypertonicity and cramping in our neuro rehab patients. It can improve the tolerance to stretching since the muscle fatigue is reduced due to magnesium ATP formation. So it helps us in improving tolerance to stretching, manual therapy and therapeutic exercise, better recovery from any post-exertional muscle fatigue. So this is how magnesium competes with calcium. Coming to nerve conduction, it blocks the voltage gated calcium channels, so it prevents the neuronal hyperexcitability and everything. It regulates the voltage gated sodium channels, so it maintains the resting membrane potential. It stabilizes the membrane. It is a natural NMDA receptor blocker, so that helps us with the central sensitization, and which helps us ultimately in treating the chronic pain conditions. So from rehabilitation, we know that it can reduce, for all these mechanisms, it reduces neuropathic pain, paresthesia and fasciculations. It reduces the central sensitization, as I have talked about, and it helps in the smoother motor control and improve neuromuscular coordination. So this is how the NMDA receptor is blocked. In energy metabolism, ATP is only biologically active when it combines with magnesium. It is required for all the important biochemical cycles like glycolysis, beta oxidation, TCA, and it also improves the stability of the mitochondria. So ultimately, what will help? It improves the muscle fatigue, it improves the endurance and strength during therapy, reduces fatigue, better post-exercise recovery, and ultimately enhanced healing due to the adequate supply. It also has a huge role in reducing the inflammation, like it reduces the pro-inflammatory cytokines, interleukin 6, TNF alpha, interleukin 1 beta, that are notorious in autoimmune diseases like rheumatoid arthritis. It suppresses the nuclear factor kappa beta activation and stabilizes the mast cells. So it decreases the pain sensitivity, improved mobility in inflammatory conditions, and faster tissue recovery. Coming to the bone health, it is greatly involved in the hydroxyapatite structure and the bone mineralization. It supports osteoblast function and inhibits osteoclastic activity, vitamin D activation and PTH regulation by magnesium, and ultimately enhances the muscle performance. So we can use it in cases of fracture healing, post-surgical rehab, as well as is improved bone density. Obviously, it improves the osteoporosis progression. Ultimately, what we'll have is the reduced risk of fall. So who are the population who are likely to benefit from this magnesium optimization? Patients with chronic pain or central sensitization who are resistant to every other treatment, individuals with muscle spasm, high tone, post-stroke spasticity, We have neuropathic pain, neuropathic symptoms or nerve compression. Patients who are not tolerating therapy due to low endurance, fatigue or metabolic dysfunction, older adults with osteopenia or any fracture history, we can add magnesium along with calcium, and individuals with inflammatory musculoskeletal conditions. So what are the outcomes we expect by giving magnesium? It will reduce the pain and muscle, it increases exercise tolerance and participation, it increases the functional mobility and gait stability, reduces the risk of falls in elderly due to muscle weakness, and it reduces the risk of fractures, improves tissue healing and recovery. Thank you.
So from your experience, do you suggest a compulsory addition of magnesium along with calcium and vitamin D in the elder aged group?
Sir, definitely, sir. Definitely, we can add magnesium. There is enough study to prove that. I have personally used in case of fracture, post fracture, during the post fracture rehab, we can add magnesium along with vitamin D3 and calcium. So it improves. It improves according to the mechanism of the muscle relaxation and muscle functioning. The role of magnesium in muscles, we can add magnesium to my experience.
Thank you.